Well, it seems like every week we hear an amazing story about how our friends at Rascal Animal Hospital helped treat an injured animal, took part in a rescue effort, or provided medical services to pets whose owners couldn't otherwise afford it. It is an understatement to say that head veterinarian Dr. Michelle Gonzalez is a busy woman. I honestly do not know how she does it all. But what I do know is that she's motivated by one thing: protecting and helping the animals in our community. Dr. G, as we like to call her, is here with us today to share more about the work that she does through Rascal Charities. So welcome as always, Dr. G.
Hi, Robin.
Okay, you got this guy. I'm glad you dressed him up.
Yes.
And he's wearing the perfect outfit. So
That's
tell
right.
me about him.
He is representing OSU. So this guy, his name is Ed. He's a terrier mix. He's 4 years old. He's being adopted through PAWS, which is Powell Animal Welfare Society, an awesome group, foster-based. And this guy, he knows basic commands. He's been sitting for us really well. He's very active, so probably a house that's going to be able to keep him busy is going to be great. Does great with kids so far. I don't think that he has been cat tested, so I'm not sure about that, but anybody interested in adopting him can get information from PAWS.
Except for Michigan fans need not apply.
That's right.
He's coming with that.
He is all Buckeye.
Yeah.
Yes.
All right, perfect. Okay, so in addition to running Rascal Animal Hospital, which we know you all do, you have Rascal Charities.
Right.
So tell us what this group is all about for people who aren't familiar with it.
Yeah, so Rascal Charities was started back in 2006, and basically is an animal care welfare organization. It's a nonprofit 501c3, so all donations are tax deductible to people. And it has a lot of different things that we do. We help animals that are in need as far as providing medical care. We work with organizations like Animal Cruelty Task Force of Ohio. We have been doing a lot of hoarding cases, animal cruelty and neglect, because groups like Animal Cruelty Task Force and some of the other rescues that we work with, they have the resources to help rescue the animals, but they don't have the medical resources. So that's where we come in. We can provide the veterinary care, we can provide the wellness, and then also the sick care. So we help with that, and then also with education, because education is so important. You know, like the good owners of tomorrow is going to be the kids of today. So it's really important to teach everybody, the kids and the adults, on how to properly take care of animals so that, you know, the animals can be healthier and live better lives.
Okay, and you know, you obviously sent us a lot of pictures. We're looking at some of these, and this is just a small sample of what you've done. So let's look at some of these and tell us maybe the stories behind these.
Yeah, so some of these pictures are about patients, like this little guy. You know, these are some animals that have been cruelty cases. So either they have been like some of the pit bulls that we have dealt with that are bait dogs, that people unfortunately get these dogs to train fighting dogs, and these dogs get destroyed and mauled by other dogs. So we help provide veterinary care. There are some others that are just either the people cannot afford to care for them. Currently, we have a little puppy in our care that the person got from Craigslist. The dog's really sick. They cannot afford its care, so they surrendered it to one of our groups so that we can help provide the medical care for it.
And you talk about the groups you work with, because that's a big part of this.
Right.
You have a lot of partnerships.
Absolutely. We work with probably over 30 groups as far as providing the medical care. And some of them, we're not the regular veterinarian for wellness stuff. We just help with the emergency things. Since Rascal Animal Hospital is open 24 hours, if they rescue a dog in the middle of the night, or, you know, hit by car, or right now with the cold weather, if there's a dog outside, anything like that, they can bring them to us at any time. And then we can help with low cost. We can help provide the care that they need.
Now, Rascal Animal Hospital, are you guys funded through any state, local government? Are you just...
No, it's not. We're not government funded. So Rascal Charities, everything that Rascal Charities does is through the help of donations, and then some people will sponsor a clinic, even sponsor a pet. Somebody may say, hey, you guys got a dog from Dash Animal Rescue that needs help. Can we provide some money support towards their care? So they will give money to Rascal Charities to help cover that care. Somebody may sponsor a hoarding case. So that's how we're able to do it. And then we also do fundraising, which some of the pictures that we've shown are of like the guest griller. That Bob Nunley was actually one of the guest grillers with me. So we do things like that to try to raise money to do what we do.
Do you have any idea of how many animals you've helped in an average year?
Well, you know, we see somewhere between about 15,000 to 20,000 animals a year, whether it be for spay-neuter through the Rascal unit, or for regular wellness things, or for emergencies. So, I mean, we see a very large number of animals.
Okay, Dr. G, if somebody wants to help do any of those things you just talked about, donate, how can they find you?
So Rascal Charities has a website, which is rascalcharities.org. And on there, there's information about the things that we do. And then there's also information on how people can sponsor a clinic or help with donations. We accept donations through PayPal. People can mail a check, or they can stop at the Rascal Animal Hospital and make a donation directly into the Rascal Charities account.
Okay, and again, Ed is through PAWS, right?
Powell Animal Welfare Society, looking for a good home.
Okay.
A Buckeye home.
Well, thank you for all you do, of course, and thanks for being here.
Thank you.